over 22%. That's the highest of any city in the province. Now, behind me here, this is one of the 20 chosen pharmacies that are now offering the AstraZeneca shot 24/7. And while that's great news, the mayor of Brampton says he's found yet another issue with the vaccine rollout, showing the unfair allocation of doses in this city.
I was looking at the data this weekend and I looked at the pharmacy rollout. And unfortunately, this is another example where we're not seeing the focus on the hotspots that's merited.
Mayor Patrick Brown has sent yet another letter to the province pointing out what he believes is the unfair rollout of vaccines. And here's what he found. Per capita, the city of Brampton has 8 pharmacies per 100,000 residents that are offering the AstraZeneca shot. Toronto has 9, Mississauga has 10, and Kingston has 26 pharmacies per 100,000 residents.
Since the very first COVID-19 vaccines were administered, it was downtown Toronto and downtown Ottawa, neither area that was in outbreak. And unfortunately, I think that pattern has continued. I think there should be a correlation with cases and the number of vaccines. We're not there yet, and unfortunately, the pharmacy rollout has amplified that.
We reached out to the Solicitor General's office and the Ministry of Health with a list of questions about this. We received a response that did not explain why Brampton has fewer pharmacies per capita despite having higher case counts than the other cities. But the Ministry of Health did say enrollment of more pharmacies is ongoing across the province. And this all comes as Peel Region's top doctor paints a grim picture of the current situation.
This is, unfortunately, the crisis that we feared.
Brampton is now seeing more than 466 cases per 100,000 residents, with a record number 200 COVID-19 patients currently in hospital.
They are airlifting patients to other hospitals. If it wasn't for other hospitals handling the overflow at Osler Health, we would have no capacity to deal with the incoming COVID-19 patients. So to say that we're at 100% capacity at Osler is an understatement.
And today, Dr. Lowe defended his decision to issue a special order that would shut down entire workplaces with outbreaks, saying it may not be easy for businesses and workers, but it is necessary to save lives and our collapsing healthcare system.
The patients fighting for their lives are our most vulnerable, our elderly, but also our essential workers who are increasingly younger and are often our newest Canadians and our racialized residents. When the hospital beds run out, care will suffer, not only for COVID-19 patients, but for anyone who needs emergency help, life-saving treatment, or surgery.
Now, something else that was flagged by the mayor of Brampton today is concern over the new variant that's believed to be fueling the pandemic in India. It's the B.1.617 mutation. It's also known as the double mutant. Brampton City Council says it will be putting pressure on the federal government to shut down international travel in an effort to keep cases and new variants from entering our country.